Thanks for joining us, everyone. This is our first live Zoom update for 2026, so we really appreciate you all being here. We'll start with just a couple of housekeeping items. One, if you don't have your mic muted already, if you wouldn't mind muting your mic, that would be appreciated. And then two, if you have any questions as we go, please feel free to enter them in the chat. And then time permitting, we will either get to them in this call or we will follow up with you by email. With that being said, I want to welcome Remenson, who is our Chief Operating Officer based in Haiti. So, Remenson, thanks for joining.
Thank you for having me, Chris.
So, Remenson, it's been a little while since we did one of these live Zooms, and we've had a lot that has been happening in Haiti. So, I think a great place to start would be if you could give us just sort of an update of what is going on in the country and really what the situation is like.
The level of needs right now is extremely high. As you can imagine, according to the report, the PCI IPC report, today about 5.9 million Haitians, which represent more than half of the population, have little to no access to food. Over 100,000 children, unfortunately under the age of 5, are suffering from severe malnutrition, and more than 300,000 are already stunted as a result of long-term malnutrition. There's 1.4 million people who have been displaced due to gang violence, and among them, there are over 700,000 children who are suffering and displaced from the political instability and gang violence in Haiti. So what we are seeing now is a growing movement of families moving and fleeing from Port-au-Prince and the major metropolitan area. And we're also seeing people are moving or fleeing from the Central Plateau area, especially around Mirebalais, as well as in the Artibonite Valley. Near Saint-Marc and near Gonaïve and Pont-Sunday, there's a lot of unfortunate movement that push people to move towards the north, which put a lot of pressure on the north, given that it wasn't prepared and ready to receive so many people down here today. And what we are seeing is they are arriving, unfortunately, with nothing. You can imagine if people are fleeing from the house, they have no time to pack up or to get anything. So some of them arrive with no income, no support system, and often no guarantee of the next meal. So what this creates really is an increasing pressure on the food access and basic services in the north, which is why we're seeing so many issues and challenges that the north are facing, especially the around the city of Cap-Haïtien, Limonade, and Cartier, and also down the northwest of Haiti.
Yeah, that displacement, can the impact of that. I think about the infrastructure challenges that sort of were already there and already constant, and then how much this increases that, right? How much it exacerbates the challenge, and especially a significant portion of Haiti's food traditionally is brought in sort of through Port-au-Prince or the Dominican border close to Port-au-Prince. So I imagine with the expansion of the gangs in the south and then the displacement of people, that's also putting a huge strain on the food systems and access to food there.
Definitely, you touch on a point that is very important. You know, we are not too far from the Dominican Republic. You know, there's a lot of people who are being deported from the DR as well, and people moving up north is a big challenge, and the reason is because um, you already have the infrastructure that were not established in a way that they could support all of this influx of people. And according to the mayor of Cap Haitian, on the most recent numbers, he stated that about 30% of the displaced people are moving to Cap Haitian. And as you can imagine, Cap Haitian is a very small city, and also On top of that, you have the port of Cap Haitian and the airport of Cap Haitian. They become the number one port of entry in Haiti, and they were not equipped and prepared to receive so many activities in operation. So it's really putting more pressure on a system that were not built to support all of these activities. So it's very critical, and people are in search of a better life, so they see the north as the new haven. So this is why they're coming here, but it doesn't come without any challenges. It comes with all of the other issues because there's not enough infrastructure available to receive and support all of these operations. And even organization moving up north, they are also putting pressure on the port itself because it's becoming more congested because they cannot ship things down to Port-au-Prince or even in Saint-Marc, which is where you have the major ports going down south of Haiti.
I remember when I learning about and at times you and I have discussed it that like at the port they have this what we call a top loader, right? This large forklift that's used to move the containers around. And historically they've only had one, but with the sort of demand and the port usage that was going on, it was sufficient. But now you're seeing this huge influx of shipping containers coming to the north, and they're still trying to manage it all with this one large top loader, right? The little things we don't think about, but it can have a huge impact when the infrastructure isn't there, and then you have this sort of surge of demand. Um, one and I think one of the other big things we saw in 25 was the reality that as people were moving to the north, as areas of the country became more and more food insecure, we it really became apparent that when you're doing humanitarian aid and development, it's not just about having goods in the country, but it's about are they able to get to the people that they need to, right? Are people able to benefit from these services? And I know this is a subject that you and I have talked about hours and hours and hours over the last even really few years as we saw this develop. But I think the initiatives that you all have put in place really near the end of 25 and through this year have made a huge impact and have really, I think, are a testament to sort of the planning, the impact that can happen when organizations are at the ground level and really localized. And even we've been working, I know, with the last probably 4 months with clinics all over the country that have not been able to get supplies from the Ministry of Public Health, and we've been working sort of as a liaison between them, between large international NGOs, trying to get these clinics registered, getting not just ready to use therapeutic food for severe malnutrition, but also these other critical humanitarian supplies to their facilities. And because the work you and your our team are doing, this has started happening. We've received those testimonies and those pictures. Uh, so there's a lot of work that's been happening on partnerships. Can you tell us about that?
When we talk about the issue of, displacement, gang violence, there's also the roadblocks that you have because there's no free access for goods and even for people to move. And given that Port-au-Prince was, and it still is, but given with all of the challenges that they are facing, so Port-au-Prince is not, it's no longer the center or where everything is centralized. So, and organizations in Haiti are working towards, doing decentralization to make sure that they can have access to do distribution and to make sure that product like plum peanut or even essential medicine and medical supplies can reach to the last miles. So looking into this, one of the initiative that we work on and we've been successful on that is working with the Ministry of Health in Haiti, as well as with the UNICEF to come up with a plan where we can facilitate and we can actually do last mile distribution. What do we mean by that is in the past, we would do distribution solely to the Ministry of Health warehouses or depots on the main department capitals like Port-de-Paix, Inche, Fort Liberté, Cap-Haïtien, and Gonaïves. This is where we do the distribution, and then from there, the product is dispatched and to make it to the last mile to the clinics. So what we're seeing is that due to so many constraints, so many issues and challenges, they were not able to ensure that the product get to the clinic. So we work with them, and at the end of 2025, as we mentioned back in September and October, we started this project where we said, okay, we are going to take on the responsibility to do last mile distribution. And I can tell you, with this, we're able to supply 50% of the country with IUTF, plumpy nut or medicament for the treatment of children, but also with essential medical supplies as well as equipment for prenatal and all of the medicine required as part of the nutrition program. So it's been a success, and the testimony, even the work that we've been doing, we've seen the impact on the relationship that we have been able to build with the Ministry of Health staff working on those clinics, but also being able to better understand the roadmap and the difficulties that the country is facing when it comes to get the product to those who are most needed.
I think when we look at that IPC level you mentioned earlier and the places that you're talking about now that you and your team are delivering to, a significant portion of the most heavily impacted places in the country are where you guys are making these distributions to the last mile now. And I was looking at some of the numbers for impact in Haiti that are published by the bigger international NGOs just a month or so ago. And I was looking at the difference between the first half of 2025 and then the second half of 2025 when this sort of last mile work is being done. And the numbers, the total number of kids were able to more than triple by the end of 25 compared to that first half of 25. And I know there's many pieces to that, but the work that you and your team are doing, I know was a huge piece because, as you said, it's 50% of the country you're able to now ensure gets product on a regular basis. Which again, the testament to localization, right? As we're seeing all these, even internationally, the challenges around supply chain and logistics, it's a stark reminder that, of course, getting product somewhere is becoming more and more difficult. But once it gets there, getting it to the beneficiaries, and that's what you guys are doing. Um, the second, another area that I know you guys have really stepped up is in agriculture, really food and nutrition security. So can you tell us about the initiatives that you guys are doing right now around that?
With increasing pressure on food access in the north and throughout the whole country, but in the north in particular, it is really critical to strengthen our local production. And MFK has been on the ground working into, building training and working with farmers and providing the tools that they need in order for them to not only improve their peanut production, but also increase the yield of the peanut production. So about maybe 2 or 3 years ago, we started working with World Food Program, and then we have a partnership where we are working to increase the number of farmers, also the number of communities that we work. We started with this training in 2024, finished the whole thing in end of 2025, where we train over 600 farmers. And this year, we are on our second year where we'll train 960 farmers. Really, through this partnership, what we do is really providing good agricultural practices for the farmers. And this include soil preparation, harvest and post-harvest management, safe production methods, and even improve processing techniques. Like in the last session or this cohort that we are training, we even incorporated a training where we train farmers and also staff from the Ministry of Agriculture how to use equipment and do testing or test over aflatoxin on the peanut. So that allow the farmers after harvest they know exactly the quality of the peanut. So, with this partnership, one of the things that is very crucial that we notice is that there are some communities who have not, uh, practiced peanut growing for over 30 years. They basically gave up on producing peanut. They said, okay, we're not doing this. And when they started doing the training, they were really interested into that. And like in Lembe, for instance, we have two communities now that we are doing farmer training. And on top of that, it is we're not only doing the training, but we are also working to help them to have two seasons, to understand that they can actually take advantage of the two seasons that are available. And the testimony that we have is really great. And you can see behind me, for instance, this is one of the peanut field that we went on the tour that we can actually work with the farmers to make sure that they understand this. And they are very happy with this. And by doing this, it's really allowing us to decentralize the food access and move toward a more sustainable and local solutions.
When I was with you and your team in Haiti, gosh, what was that? Maybe 7 or 8 weeks ago now, and we went out to that little agricultural community that was it was really far out. Um, and while you guys were working with the sort of main farmers, I was talking to one of the guy's sons who was in his late teens, and he was just telling me about his dreams and his aspirations as we were talking, and saying that his heart really was to be able to go to medical school, right, and to get into the medical profession. And I was asking him, just talking with him about it, and it's becomes so real when you're talking to people. And this guy was smart, he was on top of it, right? And I realized, I'm like, gosh, if not only is this work that you and your team are doing around agriculture, increasing food security, improving the nutritional quality of those foods, but it's also helping to generate that income. And for guys like this young man, for young men and women in these sort of rural areas, their biggest chance about being able to pursue education and create these different pathways for themselves and their families is their can they increase this agricultural yield, right, and the market access, which is what you guys are doing through these aflatoxin programs. And so that conversation with him really stuck with me, and drove down maybe another reason that this work is so important. Uh, so it's really incredible what you guys have been able to put together. So I appreciate the work of you and your team on making those initiatives happen.
Thank you.
And probably the other big area of partnership that I've seen a lot of growth in is around school feeding. And specifically, we have our product Vita Mamba, which is a fortified, highly nutritious school snack that was designed in collaboration with the USDA and partners in the US and the Haitian government to be distributed in Haiti and in two Haitian schools, and really enhance the nutritional density of that children have access to in their foods. And you guys have done a lot of work in this area, and it is a critical time to be doing this work. So tell us a little bit about that.
Vitamaba is kind of tied into the ag program that we are doing because it's one of the products that we are able to incorporate more raw materials into our recipe. And this is one of the key metrics or KPIs that we have is when we do the farmers training, how do we um, ensure and also assure success of this program. And the way we do this is by having more peanut available into the market that we can incorporate into the production of Vitamaba. So last year, for instance, we um, work with World Food Program the Bureau, the Development and Nutrition (BND), and through our own train or our own school feeding programs, where we work with a lot of schools, we were able to reach over 21,000 children through this program. And this is new, and it's a success for us because we know that there's a lot of potentials with Vitamamba. Because one of the main reason is because when we talk about food insecurity, when we talk about access to food and also access to nutritious food, this is where we have a big challenge because kids are eating a hot meal in school when it's available. But as you clearly stated, when it comes to the nutrition density, we are not at that stage yet. And there are some school children who work miles away to go to school, and when they eat the food, they still lack of the essential micronutrients and the vitamins and minerals that they need. And this is why Vitamobile is crucial because it's allowed them to actually have that density that they need, and it's been a success. We've had World Food Program reaching out, wanting to buy more, to incorporate more Vitamobile into their program because it's really allowed them to provide hot meal, but also have a product that is that has all of the micronutrients that the kids need. So we're very happy to do this, and it's really a way for us to show how we are strengthening the local markets because the farmers they participate on those training, they grow peanut, sell it, we buy more, incorporate it into the product, and we distribute that through the school feeding program. And for some reason, some of the kids might be benefiting from eating that vitamin bar, that we make out of the peanut that were grown in Haiti.
It's this, I love the holistic approach that your team is able to implement on the ground, right? That you're really working from the farm to the factory to the clinics and the schools, right? And this is development work done at its best when it's really creating local capacity and resilience, right? And this is amazing work. Um, so I mean these are huge partnerships, huge programs that you guys have put in place, Remington. Oh, maybe the last thing I just remembered that, and I know there's still a lot of this calendar year left, but when you and I were talking a couple of weeks ago about Vita Mamba, I think your goal, and you guys are on track so far for reaching a little over 60,000 kids in calendar year 26, which is a huge increase. And it's just amazing to know how many children will be receiving sort of these essential uh, vitamins, minerals, proteins each day while they're at school, which is huge. So thank you for sharing that. With that being
Thank
said,
you.
yeah, so 2026 is still, there's a lot of it in front of us, a lot of challenges, a lot of opportunities. Um, what would you what would you say are some of the most critical needs or opportunities that you're seeing so far for MFK this year?
Needs, unfortunately, I think in terms of crisis, especially what Haiti is facing today, uh, there will always be needs. I think we have uh, access to nutritious food is still a big need. And we're talking about the north. If we look into the IPC report again, the northwest of Haiti is really suffering from that. So we are really working really hard and looking into initiatives where we can work with our partners. And the way that we can, the opportunity there really is to work with our partners to extend our farmer training beyond other crops. So right now, our main focus is on peanut, but we know that there's maize, for instance, that's another crop that has a lot of potentials. We talk about the breadfruit flour, for instance. How do we incorporate that into production? We talk about sorghum, for instance. Is really see work with partners to incorporate more crops into our research and extension program. And this will allow us to create more jobs, but also continuously work into strengthening the local food system. Another need, I would say, is really to expand our service to treat and prevent malnutrition. We talk about the last mile distribution, the partnership with UNICEF and the Ministry of Health. Uh, we see an opportunity for us to continue to scale up programs that will allow us to keep the focus locally, because in difficult times, it's most of the time it's very difficult for international partners to be able to operate under stress and all of the other challenges. So we really want to make sure that we extend our partnership to other humanitarian organizations working in Haiti to make sure that we can work together, but also to tackle that issue and make sure that we can be stronger when it comes to the issue of malnutrition and food security. I think the biggest challenge to me remained supply chain. You know, for many reasons. We talk about uh, congestion at the port. We talk about conflicts around the world. We talk about, access to some critical raw materials. It's a big challenge, and but also there's an opportunity um, for us as organization to continue to work with other humanitarian organization. For instance, when we talk about this partnership, like we're working with UNICEF and other agencies to create a humanitarian hub, for instance, for them to be able to store more raw materials, but extend this into making sure that we can do more in terms of distribution, in terms of reaching out to uh, isolated communities is very crucial. And really the goal is not to compete with anyone, is really to work together to make sure that we can achieve a common goal.
Yeah, I think that last part, right? How do we work together to achieve a common goal? When I think about 26 and I think about going into this year with a very different sort of the funds internationally that exist to address these issues, when I think of escalating conflict and how that's disrupted many partners' abilities to work um, in certain areas effectively, it's emphasized to me localization, right? Like how those are the systems that become resilient. Those are the systems that become the most efficient and effective. You get your shortest response times, right? When there is crisis. But it really also means that when you're working with scarce resources, that teams that are on the ground doing that work on the front line together are able to more effectively sort of figure out where do you collaborate? How do you create synergies? How do we reduce programmatic costs in order to ensure that even with scarce resources, we're still able to reach the most vulnerable? And what you and your team have been doing is achieving that in incredible ways. So I'm really looking forward to as we continue to walk through 26 and face those challenges and those opportunities. I look forward to walking through that with you together.
I was going to say, Chris, through this pathway, really what we want to achieve is really move from dependency to resilience. And the way that you do this, as you just mentioned, is really to invest in localization to and this is through knowledge transfer, through trust, but also being able to adapt to the reality or to adapt to different crises and make sure that you make the right decision. Of course, things will always be difficult, and but for us as an organization, MFK, for instance, is really we have been able to do a lot because we understood the reason why we are doing this, and we make sure that we invest in our people. I'll give the example when I talked earlier about the farmers training. I think since 2021 to date, things have unfortunately has not improved. We've seen so many issues, but I can tell you, uh, prior to having this program, there were only 3 communities that were doing farmers training, and right now we are in 16 communities. We are in 3 departments, and we are in 10 major cities in the north and northeast. So it's really through those partnership, the rapport that we develop with the communities, and also find and work on that formula to move really from the dependency cycle to resilience, where people are equipped with more tools and ability to be able to respond to crisis and have a better life for themselves.
I want to thank everyone for tuning in. Again, thank you for tuning in. Uh, we look forward to our next meeting. We couldn't be doing this. Remington and his team couldn't be making it happen without just all the amazing support, encouragement, donations, incredible board members, partners. So we really thank you all, and we look forward to catching up next time. So that being said, have a great day. Thank you.
All right, thank you.